right, good morning, everyone. So thank you for having a little patience for us. We were having a little bit of video issues as we were getting started. But we're gonna get started here in just a second. All right, well, good morning. So again, sorry for the slight delay, but we're gonna go ahead and get started now. And I wanna thank everyone for joining us this morning. My name is Chuck Brown. I'm the Communications Director at OpenSky Policy Institute. And I wanna thank you for attending our first Policy and Equity webinar. Some of you might expect to see our Executive Director, Renee Fry, emceeing this morning, but she just returned from a well-deserved sabbatical, so I'm gonna fill in for her while she gets resettled, but don't fear. We'll get some Renee time later in the series. But I'll be with you for today. So we're very excited for today's webinar and for the rest of this series, and we're thrilled you're joining us for this. We have a lot of people online this morning, and so I want to give a little moment to describe OpenSky. For those who may not be familiar with us, we are a nonpartisan, nonprofit fiscal policy think tank that examines state tax and budget policy here in Nebraska, as well as K-12 finance. I want to thank our staff and our board of directors and members of our Racial Equity Advisory Committee for helping pull this series together. It's really been a team effort, and we're really excited about this series. We think it's going to be an engaging series of conversations that we hope will really just be the start of a larger ongoing conversation about the way public policy interacts with racial and ethnic equity. We do have a full program this morning, but I do want to talk briefly about why we're doing this work and doing the series. As a think tank that examines fiscal policy, we've always been very aware of the connection between fiscal policies and racial and ethnic equity. The way governments collect and allocate revenue can work to directly either reduce or exacerbate ongoing racial and ethnic inequities. As a staff and as an organization, we have grown to the point now where we can more directly explore these connections between policy and equity and make that a larger focus of our work. And in this series, we're going to largely focus on key public policy areas of K-12 education, corrections, healthcare, housing, and economic development. And of course, tax and budget policy will also be part of the discussions we have over the next few weeks. At OpenSky, we believe a more equitable Nebraska is a stronger Nebraska. By having these conversations and by working to increase equity and opportunity for every Nebraskan, we build a stronger state. That is why we are here today, and that is why we do this work. Again, we have a full program this morning. And a great discussion ahead, one that will start with a presentation from Dr. Barbara Gomez from the University of Nebraska, Omaha, will provide us with some data that helps illustrate our current racial and ethnic equity picture. We'll then move directly into a panel discussion featuring our panelists, who are Dr. Cheryl Logan, who has been the superintendent of Omaha Public Schools since 2018. Dr. Logan will help us see this conversation through the K-12 lens. Senator Danielle Conrad, who is the executive director of ACLU Nebraska and also a former state senator who represented Lincoln's Fighting 46th district from 2006 to 2014. Senator Conrad will help us explore race and ethnic equity as it relates to corrections issues. Dr. Donna Polk, who has been the chief executive officer for the Nebraska Urban Indian Health Coalition for nearly 30 years. Dr. Polk will help provide a healthcare perspective with a particular emphasis on mental health. And Dr. Erin Feichtinger, who is the Director of Community Outreach and Advocacy at Together Omaha, an Omaha-based organization working to prevent and end homelessness. Dr. Feichtinger will bring a housing perspective to today's discussion. The panel will just start with some questions from us, and then we'll move into audience questions. If you have questions for Dr. Barbara Gomez, we will address those at the same time as we move into the Q&A as well. A couple other housekeeping notes before we get started. Attendees will be on mute the whole time. If you have questions, please type them into the chat box at the bottom of your screen. Please limit your questions to 2, which will make it easier for us to monitor questions and will allow as many people the opportunity to ask questions as we can. We will do our best to get to all questions, but we are constrained a little bit by time, so we'll see how that goes. We do want to note also that all webinars will be recorded, and slides and other materials will be distributed to our listserv after each webinar, and they will be on our website as well. So that's the formalities. So now we're excited to get into the meat of today's presentation, or today's discussion, and we'll start that with a presentation from Dr. Gomez, who is an assistant professor of public policy and Social Equity at the University of Nebraska Omaha School of Public Administration. Her research examines the intersection of the public policy making process and the politics of minority groups and the ways in which public policies have different impacts on ethno-racial minorities. And so Dr. Gomez, if you could go ahead and begin your presentation now. So. And I'm gonna unmute you real quick. So. Dr. Gomez, you're muted, so yeah.
Oh, thank you, Chuck, for the patience. Again, my name is Barbara Gomez Aguinaga, and today I'm an assistant professor at the University of Nebraska at Omaha, and I'll provide an overview of the inequalities across racial and ethnic groups that are happening in Nebraska. And this will provide a landscape to better understand the points that the panelists will make. So we will start providing a basic demographic profile of communities of color in Nebraska, followed by the housing and healthcare gaps that are currently, and then followed by corrections data, and we will close the presentation with data on K-12 education across racial and ethnic groups. So let's start with the demographic profile of Nebraskans. Today, more than 1 in every 5 Nebraskans are a person of color. Specifically, 21% of Nebraskans are racial and ethnic minorities. And this is a growing change that the state has had in the past decade. As you can see here, back in 1990, only 7% of Nebraskans were a person of color. And a person of color includes African Americans or Blacks, Hispanic or Latinos, American Indians, Asian Americans, and Pacific Islanders, and Native Hawaiians, and people with mixed racial backgrounds. So we went from 7% in 1990 to 12% of Nebraskans being a person of color in 2000. And by 2018, the share of Nebraskans of color tripled from 1990, with 21% of Nebraskans now being a person of color. So what is the composition of people of color in Nebraska? When we disaggregate this group a little more, in this figure, you can see the percentage of the population that each specific group represents in the state, with Latinos representing 11% of the state population, followed by African Americans accounting for 5% of all Nebraskans. Asian Americans represent about 3% of all the state population. American Indians, 1.5%, and Native Hawaiian and Pacific Islanders, 0.01% of the state population. So these distributions show the growing presence of communities of color in the state, with, as you can see here, Latinos taking the lead in the presence in communities of color in the state. So now that we reviewed the growing diversity of the state, let's dive into the gaps among racial and ethnic groups, starting with poverty and housing. So this figure shows the poverty rates by race and ethnicity in Nebraska and across the United States. The red bars represent the poverty rates across Nebraskans, whereas the gray bars show the poverty rates across the United States. And as you can see here, American Indians are the group with the highest poverty rate in Nebraska, with 34%, followed by Latinos and African Americans. In other words, in Nebraska, 1 in every 3 American Indians is living in poverty. Not only that, but as you can see here, American Indians in Nebraska are 10 percentage points more likely to be in poverty than American Indians across the country. This is a very significant difference that policymakers and practitioners should take note of. And we know that poverty doesn't come alone. It also influences many other outcomes in life, including housing. Specifically, when we talk about home ownership, there is a very significant gap on home ownership rates in the state. The figure here collected from the U.S. Census Bureau that shows data from the U.S. Census Bureau shows that 70% of non-Hispanic whites in Nebraska are homeowners, compared to 43% of Latinos and 30% of African Americans. This means that non-Hispanic whites are 62% more likely to own a house than Latinos, and 2.3 times more likely to own a home than African Americans. So this is a very significant gap that we have to keep in mind when addressing inequalities. So now that we cover poverty and home ownership, it's time to talk about health and healthcare. So there are substantial differences in terms of access to healthcare and insurance coverage among Nebraskans. As data from the U.S. Census Bureau reveals, 23% of Latinos do not have health insurance coverage, followed by 16% of African Americans without health insurance. Only 7% of non-Hispanic whites in Nebraska do not have health insurance coverage, as this figure shows. So this means that in Nebraska, Latinos are more than three times more likely to not have health insurance coverage than non-Hispanic whites. And African Americans are over 2 times more likely to lack health insurance coverage. So those are very remarkable gaps. And the racial gaps in accessing health insurance are greater in Nebraska than in the United States at large. As you can see here, the gray bars are the share of Nebraskans without health insurance, and the gray are the ones across the US. So Latinos in Nebraska are 4 percentage points more likely to lack health insurance coverage than Latinos elsewhere in the country. And African Americans in the state are 5 percentage points more likely to lack health insurance coverage than African Americans across the country. This is a remarkable gap, especially during the current health emergency that we are expecting today. Which takes us to the next point, which is coronavirus or COVID-19 cases in Nebraska. As we can see here, we can see severe racial and ethnic disparities in the COVID-19 cases in the state. The gray bars of the figure show the percentage of the population that racial and ethnic minorities represent in Nebraska, whereas the red bars show the percentage of cases of COVID-19 cases across these groups. As you can see here, Latinos account for about 11% of the population in the state, but they account for over a quarter of COVID-19 cases in Nebraska. This is a very substantial gap in COVID-19 cases. And in terms of cases among other racial and ethnic minorities, the gap in COVID-19 cases is not as remarkable as Latinos. But when we take a look at the COVID-19 deaths in the state, we have significant disparities pretty much across all racial and ethnic minority groups. Again, Latinos represent 11% of the population in Nebraska, yet they account for 19% of all COVID-19 related deaths. African Americans account for 5% of the population in Nebraska, but they account for 7% of all the COVID deaths in the state. Asian Americans account for less than 3% of the population in Nebraska, but they account for 4% of all COVID deaths. And American Indians represent about 1.5% of the population in the state, and they account for 2% of all COVID-19 deaths in Nebraska. So these health disparities are worth highlighting, not only because of health insurance coverage or COVID-19 cases, but also because we're talking about lives. So now moving on to the corrections or criminal justice system in the state. This figure, this slide presents the percentage of arrests in Nebraska across the following racial groups between 2017 and 2019. This is a data analysis from CPAR, which is for coming, and shows that over those 3 years between 2017 and 2019, 29% of all the arrests in the state occur among Blacks or African Americans, followed by 16% of American Indians, who, they represent only 1.5% of the population in the state. And arrests among whites account for 6%, and Asian Nebraskans only account for 2% of all the arrests done in the state on average in those 3 years. So those are very substantial differences across racial groups. Now, it is important to note that data on arrest and incarceration is kind of difficult to find, but we can talk more about that in the Q&A section. Now, the last item to discuss is K-12 education, where there are also substantial disparities here. These slides show that there are racial disparities in the percentage of high ability learners by race and ethnicity. 20%, as you can see here, 20% of Nebraskan children of Asian descent are in the high ability learning program. So out of for every 10 Asian children in the state, 2 of them are in the high ability learners program, followed by 16% of non-Hispanic white children, and 8% of American Indian children, 7% of Hispanic children, and 6% of African American children in the high ability learners program. This means that African American children are almost 3 times less likely to be in the high ability learning program than non-Hispanic white children, whereas Hispanic and American Indian children in the state are 2 times less likely to be in the high ability learning program. These disparities carry on to high school graduation rates. As you can see here, this figure shows the public high school graduation rates of the 2018 and 2019 academic year. As you can see here, 93% of non-Hispanic whites graduate from high school in 4 years, followed by 84% of Asian Americans and 81% of Latinos in the state. However, as you can see here, less than 80% of African Americans and American Indian children graduated from high school in that year. And while there have been changes in high school graduation rates in the past decade, these disparities have consistently occurred. And again, that is something that we can discuss more in the Q&A section. So I want to close by saying that, in the state of Nebraska, there are racial and ethnic gaps among multiple issues, including housing and poverty, health and access to health insurance, incarceration or corrections, as well as K-12 education. Now, it is important to be aware of these disparities, not only because of the growing diversity of the state, but also because they have important implications among Nebraskans. Thank you.
Thank you, Barbara. So, and as I noted before, we will have video and slides. So Barbara's slides, we'll share them with you after the event. We'll send them out on our listserv and post them on our website. So at this point, I'm going to go ahead and ask the rest of our panelists to turn their video back on, and we're going to move to a Q&A section. And again, I will start by asking some questions from us. But if you have questions, just go ahead and type them in the Q&A chat, and we will try and get them all answered. But I will start with a question that I'm going to pose to all of you, and Dr. Logan, I'll have you respond first if I can. But to help audience members understand the relationship between policy and race equity, can you give an example or two of a public policy that impacts equity in the world in which you'd work, and how that is currently playing out. Once again, Dr. Logan, I'll start with you. Oh, I don't see Dr. Logan. So we may have had a tech issue. So Danielle, would you mind if I go ahead and move to you on this one?
Sure, happy to jump in. And number one, let me just say thank you so much to OpenSky for the generous invitation to join you all here today. And I see that we have a fantastic group in attendance as well. And it's always very humbling and an honor to be on a panel with such esteemed leaders in our community like you've assembled here today. So it's nice to see so many good friends. Well, I'm going to focus more specifically on our work in the criminal justice system for the remainder of this presentation. But of course, at the ACLU of Nebraska, we are always bringing a race equity lens to our work to advance and protect civil rights and civil liberties across all issues. But one thing that I can tell you, having had an opportunity to really dig in deeper to the research, specifically in the criminal justice arena, what you'll find in Nebraska persistently and pervasively is at every single juncture, at every single point in the criminal justice system, there are gross disparities when it comes to racial inequities, whether that's the first point of contact by law enforcement, whether that's whether or not there's a search performed, whether or not there's arrest, what the level of bail might be set, what the length of sentence might be, extraordinary disparities for those subjected to solitary confinement once incarcerated. And then those disparities continue when you look at parole and probation, and then of course don't stop once somebody's is system involved, because we know that there's lifetime lasting consequences that come with criminal system involvement in housing, education, healthcare, and of course civic engagement and voting, and jobs and economic opportunity as well. So when you have those significant racial disparities, you can see that racial injustice is really fueling mass incarceration in Nebraska and beyond. And not only is that problematic from a system that's supposed to be built on equality, but because of those lifetime lasting consequences, it also diminishes opportunities for all Nebraskans to succeed equally in school, in the workplace, and making sure their voice is heard at the ballot box. So that criminal system involvement, those gross disparities that we see in Nebraska is in and of itself problematic, and then has those exacerbated effects across all levels of public life because of those lifetime collateral consequences. So when you start to really dig and really look at this in a clear-eyed way, and gratefully, thanks to the incredible outpouring of community engagement in Nebraska and beyond in the wake of George Floyd's death and James Scurlock's death closer to home, you're starting to see policymakers and thought leaders take a closer, harder look at some of these issues and really dig into some of the great data that Dr. Gomez and others are providing. But one area that we still see a significant lack of information for all stakeholders when they're engaged in policymaking is the fact that we don't have those racial justice statements available to help evaluate legislative policy. So I know from 8 years in the legislature and 8 years on the Appropriations Committee, every piece of policy that comes through our beautiful Nebraska legislature has a fiscal note so that we have an understanding about the impact on the taxpayers. And state after state and locality after locality have started to bring that same sort of information into the policy arena with utilizing a race equity lens. Senator Vargas and others in Nebraska have tried to bring forward that reform to complete some of the policy analysis in the Nebraska legislature through legislation, through rules changes, et cetera. And those efforts have thus far been stymied. But it's important that we continue working on that front so that we can have a full understanding of the landscape, particularly in the criminal justice and sphere and other spheres when policymakers are deciding how to cast those votes, recognizing that they don't impact all Nebraskans in the same way.
Thank you, Danielle. Dr. Polk, I'll go ahead and pose the same question to you. If you could give an example or two of a public policy that impacts race and ethnic equity and how it plays out. And there we go.
Thank you very much for this opportunity. And I really appreciate Dr. Gomez's excellent presentation, because I think I was overwhelmed with some of the data that she had, particularly on arrest. And I know that I was asked to focus on health, specifically mental health, but there's almost no policy that's been developed in the history of the state of Nebraska that has not impacted the first people of this state. Very few Nebraskans even acknowledge, some of them don't even know how the state and the city of Omaha got its name, and it's never acknowledged. We can talk about disparities in terms of the judicial system or the court system or law enforcement. People don't mention Zachary Berryhills, who was killed by the police in 2017. They gloss over that. And when we talk about housing, and of course, public policy that touches any part of the social determinants of health typically does not impact American Indian Alaska Natives at the same rate. Housing, for example, we just built housing in South Omaha, 44 affordable housing units. And I did that because acknowledging that there's really not affordable, nice housing for the poor or those people who rely on assistance to get housing. But I didn't even say it's only for natives. It's for anyone who fits into that category. So, and I'm really hyped this morning because right away I was on a call dealing with the vaccine, which is another crucial issue dealing with COVID-19. Who's going to get the vaccine? Well, I have been struggling for 6 months to try to figure out how are Native people going to even be tested. So, you know I'm probably sounding a little over the top, but when I get on these hot button issues, I can't help but think, okay, what are the policies? There are so many policies that I can't describe them all, but I do want to focus on anything related to healthcare. And the most pressing issue now, of course, is Medicaid expansion. And I do have great hope that, oh my gosh, excuse me. I have great hope that that is going to open the door for many Nebraskans who meet those guidelines, who can start accessing healthcare, particularly behavioral health, because there's a stigma attached to anyone who has a mental health issue, because people often get confused when you talk about mental health and they think that you're mentally ill. That's not necessarily true if you have a substance abuse disorder or you're suffering from depression or anxiety. And so we want to make sure that people throughout the state of Nebraska, but with an emphasis on people of color who tend to be disproportionately underrepresented when it comes to health coverage, that they know that they may be eligible to access health care and mental health specifically if they qualify for Medicaid expansion. And so that's really my comment as it relates to this question, Chuck. And thank you again for the opportunity to be a part of this great panel today.
Thank you. Dr. Feichtinger, Dr. Polk talked a little about housing, but maybe you could give us a little more. So
yeah, just want to echo everyone. Thanks for having us and putting this on. These are important conversations that we all have with each other, but good to get it out there in the world. So two policies that I think are impacting race equity right now in housing. And this first one seems a little crazy, but code enforcement is a big problem. Code violations are overwhelmingly centered in rental units that are in low income neighborhoods and what HUD defines as recaps, which are racially and ethnically concentrated areas of poverty. Just as a fun hobby, my team likes to go through code cases and figure out how long they're open. And the average critical severity code case in Omaha is open for 672 days. These code violations are happening in these neighborhoods, and because these neighborhoods also see the greatest turnover because of housing instability and evictions, and they also have the highest concentration of what we would consider affordable units, not safe affordable units, but affordable units in a market that has far too few of them. We're finding that there's really no reason for landlords to resolve code violations because there will always be another person or family who will rent that unit no matter the condition. So then what you get is whole neighborhoods that look poor, that aren't nice, and to which people can point and say, see, they don't care, they aren't invested, they don't share our values. And that ends up perpetuating a lot of racist stereotypes that are founded, you know, in our history of racist housing policy, most exemplified by redlining. So we're seeing those same kind of conversations happen. I also want to note that many evictions are the action, or eviction actions are the result of disputes over code violations. Tenant complains to landlord doesn't do anything. Tenant thinks, well, I'm not going to pay until they fix it. And then they get evicted for non-payment. And that's a common example that we're seeing all the time in eviction court. One way that recently, some of you might know that Omaha passed a rental registration and proactive inspection ordinance last year that went into effect actually this year, January 1st. I worked on that ordinance, but it could be a lot better. So for instance, between June and August 2020, 39% of the eviction actions that were filed in Douglas County were people being evicted from rental properties that had not been registered under this ordinance. And even before this ordinance, we found that 41.4% of evictions between 2017 and 2020 were happening in rental units that had active open code cases with the city. So code enforcement is one way that we're seeing this play out, and that's just like a small entry point into how racial segregation in housing policy is still being perpetuated. And the other policy is the way that we handle evictions and the inequity in landlord-tenant law. Dr. Pierce Greenberg and Gary Fisher's study of evictions in Omaha points out that the 34 majority non-white census tracts in Omaha have an average median household income of $32,566 and have an average of 41 evictions per tract per year out of those census tracts, whereas the majority white census tracts have an average median household income of $71,000 and they only have 17 evictions per year. So we're seeing that evictions are a significant cause of poverty. We treat them as a symptom of poverty, and they're also perpetuating racist housing policy that we like to act that we've left behind us, but we really have not. So yeah, I'm not going to close that well, but I'm just going to say that was my two policies.
Thanks, Dr. Feichtinger. Dr. Logan is back with us, so I'll go ahead and pose this question to you, Dr. Logan. Again, the question is if you could give an example or two of public policies that impact race and ethnic equity in the world you work and how that's currently playing out. So.
Well, I would say all the ones that have been mentioned all impact us, especially at this time, because many of them deal with fundamentals of life. And so when you think about health, and some decisions that we needed to make as a school district, because we don't have necessarily the opportunity to ignore community conditions and just have school. So when you are serving many of our amazing families that we are so fortunate to serve, and you have to when you're making a decision, you have to intersect all of the things that were talked about here: access to testing, which has markedly improved, for here. When you think about housing, when you think about all of the different things that you need to affect for our young people, you can't ignore any of those. One of the reasons that we decided to provide internet for our young people is we can't wait for the public policy debate on whether broadband should be a utility. I mean, it's interesting and it's a way to admire the problem. Hey, look at the abs on that problem, but it's just not gonna get us to where in the short time frame that we had to make sure that our young people have what they need during a pandemic. Because as you know, we have, our children have the most to lose by most not being in school, and they have the most to lose by poor public health conditions. So you are trying to make decisions based on a lot of factors that are completely outside of your control, which is a normal thing, but certainly been amplified during the pandemic. So I would say all of those things are really fundamentally kind of undergird how we have to think about getting our children to school. The last thing about, you know, providing the internet was to think about mobility. You know, kids are everywhere right now. We know that, you know, families are very stressed. There has been some needed mobility that is going on, and so that children are not tethered to their home or wherever they need to be, they will have access to the technology. So I would say all of those things. There are many other things, but to be honest, all of those are things that we have to think about when we are doing making plans and decisions about how we're going to move forward with providing education during a pandemic. So yeah, all those things.
Thanks, Dr. Logan. That actually, you may have answered my next question already, so I'll start with the others and see if you can come back to it. But the question I was going to pose was how do racial and ethnic inequities in your area interplay with inequities in other areas, and how are they interrelated? And Senator Conrad, I'll go ahead and come back to you with that.
Sure, I can try and jump in there. And I talked a little bit about this in some of the opening comments about how racial disparities in the criminal justice system then exacerbate opportunities beyond the criminal justice system once that system involvement does happen. And, you know, again, if you look, and with an intersectional lens, which I think is absolutely critical, and I'm glad the other panelists mentioned this. But you look at the statistics, and it shows, you know, in Douglas County, Black Nebraskans are twice as likely to be arrested for marijuana possession as white people. You look at the impacts of our school police programs and the significant persistent disparities in Omaha and Lincoln and West Side and Millard, and how, you know, we once treated adolescent behavior or child or student discipline issues within an educational kind of response or opportunity. But now when we have increased a permanent police presence into many of our most diverse schools, that early system involvement has dramatic and lasting impacts for their educational equity and opportunity, and sometimes lasting lifetime consequences. And we need to think really deeply about, you know, those policy decisions. And I think this school police area is something that's been very interesting to us as we've been working on it over the last many years at ACLU of Nebraska. And I know others on this call have been part of those discussions as well. But I think it's a great example of intersectionality between students' rights, racial justice, and criminal justice. But for example, when you kind of start to talk with policymakers about these issues, and they're very focused on safety And we all care about safety, right? That's a value and a lens that I think is very important and very familiar. So policymakers are working hard to keep students and kids safe, as Dr. Logan mentioned, whether that's from a pandemic or any other threat to safety. But then when you really start to look at not only the statistics, but you talk to students of color, you talk to families of color, and they say, safety doesn't mean the same thing to everybody. When I see law enforcement in school, it makes me feel unsafe because of the context that comes with those law enforcement interactions in other areas of life and hinders educational success and opportunity. And so we have to look at the data, but we also have to listen to the lived experiences of our neighbors who are sharing those really important perspectives. We saw the same thing play out this summer when the Judiciary Committee held listening sessions on racial justice and criminal justice. 2 days of testimony in Lincoln and Omaha with story after story after story about how the criminal justice system impacts Nebraskans of color, and particularly Black Nebraskans, in a different way. You know, when you look really hard at the statistics that show that Black Nebraskans make up about 5% of our state population, but about 30% of our state prison population, that's absolutely inappropriate and unacceptable. But it's all based on decades of doubling down on failed policies to be tough on crime and enact a war on drugs. And not only does it have a human and moral impact, but it has an incredible fiscal impact. We're taxing ourselves to death at the local and the state level to perpetuate racial injustice and mass incarceration. And every dollar that's put into our correctional system and juvenile justice system is a dollar we're not sending to the schools. It's a dollar we're not investing in economic opportunity or health outcomes or building stable housing. So I actually think that this provides an interesting opportunity to reforge a right-left coalition to maybe help deliver tax relief and more sensible policy in some areas of criminal justice.
Chuck, can I interject real quick?
Please.
Senator made me think of something. You know, I think that that fundamental feeling of safety, when you talk about people who are Black and brown, and my second year here, when I was addressing the principals at our, convocation, and I told them that I don't always feel safe, and I don't. There are places my family says to me, don't go those places, or don't be off the beaten path, whereas, and I think that fundamental feeling of safety also is something when you think about people coming a place, staying a place, being a part of a community is really, I live in a pretty nice neighborhood, and, can certainly have privilege around providing for my personal safety in terms of some choices I get to make. But I think that is something that when you're talking about these kinds of conversations and just going all the way back to the human being and asking them about their experience, because I doubt, there's 37 townhomes in my little area, and I doubt any of and they may, but I would be surprised. I've integrated my neighborhood, I'll tell you that, in 2018. And my neighbors are fantastic, but I doubt that they feel unsafe, and so I think, some of the things that are just fundamental to the human experience, life, liberty, and the pursuit of happiness here in the United States, that we have to talk to people about why that is. And I can tell you the triggers. I could list those. They're not for today, but on another day, triggers of why I don't. But I think that some of those feelings, and I worry about them for my students, obviously my families as well, that we serve. But those are things that even as I think about the more pressing things of now in the pandemic, all of those interplay into why I don't feel as safe as I wish I did.
Thanks, Dr. Logan. Dr. Polk, if I could ask you to address the question as well of how ethnic or inequities in your area interplay with inequities in other areas.
Well, you know, one of the things being old does for me is that it helps me to understand we have a lot of talkers. I first went into the legislative chamber in 1972, and that was a time when you could just walk down on the floor and sit by your senator and bring something to their attention. And so not a lot has changed since then. They talk a lot and make promises and that's the thing. You know what Dr. Logan said is so true, in that I never thought I would live to see the day when I didn't want to go into the Black community. Come on, that used to be the safe place. And who in their right mind thinks that a police officer is your best friend? Come on, that's not why we have police. And so when I think about the things that are happening that are dividing us and impacting the most vulnerable group among all of us are our children. And that's why in my organization, we're going to go upstream and try to figure out why is it that our kids are going into the correction system that provides jobs for a bunch of people that don't look like us. And that's why they want to continue to build prisons. They're not doing a lot to help the people that are already in there, okay? And then in terms of even our school system, Dr. Logan knows that there are those of us in the community that try to help our Native kids. One of the things we tried to do was to buy them iPads or tablets before she had an opportunity to provide them in the community. Now we're trying to provide additional connectivity because, again, a lot of our people don't have, and when I say our people, I'm talking about our constituents, they don't have access. And who in the world wants to get in your car and go park in a parking lot to do your homework? Come on, it's a setup. And that's why we have to do every single thing we can to try to overcome the talkers who have no problem developing policies, and these policies only benefit them. And we don't need policies, we need money. The Creator took a look at this mess that we've created throughout the world and said, okay, I can figure out how to get their attention. I will send a plague. I will help them see that they need to clean the water, clean the air, feed the hungry, provide homes for the homeless, send out a stipend to help them. It's a lousy, what, $1,200? But we will do those things to say you have one last chance to fix this mess that you all have created. So again, Chuck, don't ever call me when I have a call before you talking about health.
I'll note that. I'm not sure I'll follow that advice, but but noted. Dr. Feichtinger, if you want to take, and then I have another question for you following this, but if you wanted to talk about how you see the interplay between your areas, that would be great.
Sure. Just like everything everyone said so far, I'm just like, that's exactly correct.
We got a bobblehead meeting.
Yeah. So to me, housing is everything. As people like to say, typically when they're about to make a really disparaging judgment on what they see as the low morals of the poor, they say things like, it all starts at home. And that's absolutely true. We know for a fact that more code violations happen in recaps. We know more evictions happen in recaps. We know that people living in these neighborhoods experience higher unemployment, more interactions with the criminal justice system, less access to transportation, more food insecurity, worse health outcomes. We know that the schools in these neighborhoods have lower test scores. They have more absences, more students moving because of evictions, because of housing instability, which obviously impacts their educational achievement. We also are now seeing that these same neighborhoods, to absolutely nobody's surprise, are now seeing the highest rates of COVID. And the biggest failure in my mind here right now, and COVID has really sort of, I think, clarified, not a sense of purpose, but kind of where we're at right now that all of us on this call have obviously been, I think, shouting about and been treated like Chicken Little, but now we're here. And all of these problems are being brought to the surface and shown that they're far more of a crisis than even we imagined. And so like the biggest failure in my mind right now is on the part of many of our elected officials and our neighbors to recognize that housing policy has been and continues to be racist. And in far too often it perpetuates the devastating consequences of our history of racism. And I mean that all the time, housing policy at the legislature, at the local level, at city council is talked about as part of the free market or economic development or workforce development. And this is really a convenient and easy way to distance ourselves from what we're really talking about, which is the most fundamental and foundational piece of people's stability, which is a home, which is a place to feel safe and secure, and that everything you go back to when everything in your life is going to be okay because you have a place to lay your head and to feel comfortable and safe. I mean, like the statutory definition of a blighted neighborhood actually includes a discussion of morals. So let's not delude ourselves into thinking that we can separate housing issues from this fundamental idea and sense that all of us have of what home means and what it should mean. And we need to create and address housing policies that increase equity with the same level of specificity and intentionality that we once created housing policy that codified racism and inequity in our communities. And until we do that, until we actually come to the same page and start at the same foundation of what we're genuinely talking about when we're talking about housing issues, we are not going to get anywhere productive or overcome any of the devastating consequences of racist housing policy that we are still living with in our community and that Dr. Logan talked about so eloquently in her own neighborhood. I got real up too, so don't talk to me in the morning, I guess.
We're going to start scheduling these for 2 p.m. So yeah, maybe right after lunch. So maybe. I have 2 follow-ups for you, Erin, actually. First is, could you define recaps?
Sure. Recaps are what the HUD, so Department of Housing and Urban Development, they call racially and ethnically concentrated areas of poverty. So these are places that are typically targeted for things like TIF or special economic development projects, that kind of thing. So yeah, I mean, recap is, once you define it, is kind of self-explanatory, hopefully. And
then the other question is, what are other solutions beyond code enforcement to pursue in order to increase access to affordable housing?
Oh, there's lots of things. One, we have a couple legislative solutions that will need to be brought back, hopefully by courageous senators. We need to reduce evictions. We have a slate of bills that were aimed at doing that, which I'm happy to go. I know we're running out of time, so if anyone wants to email me after this and talk about it, I'm happy to do that. And I will also say that one big thing we can do is Tony Vargas introduced a bill for us last session that would have added source of income to the Fair Housing Act, Nebraska Fair Housing Act, which would have said that it is illegal to discriminate against someone applying for housing based on their source of income. So right now it is currently legal, it's perfectly legal for a landlord or anyone trying to sell you a house to say, oh, you're paying part of your rent or your housing with child support or a veteran's benefit or anything like, or any kind of housing subsidy or additional assistance that isn't coming from your job. They can say your money's no good here and bar you from housing. So that's one really simple way, but I have a whole list that I would love to talk to anybody about.
And I would like to talk to you about it because when we developed our housing in South Omaha, it was unbelievable working with a large realtor who does manage properties. But the other thing that we're doing a little different, we're going to have a case manager on site in the complex, and we're also renovating a building right across the street where people will have access to services. It doesn't make a lot of sense to put people who are powerless into a situation when they know they're living in substandard housing, but they have to rely on some code enforcement person to come take care of it. And so we will take care of it. If there's a problem, I'm on it, okay?
And Donna, if you are working with people who don't have their properties registered, you just let me know and we'll handle that.
All right. As suspected, this hour was not going to even be close to this conversation. Barbara, I have one question for you. Is there home ownership or health insurance coverage data for American Indians?
Yeah, there is data at the national level. However, because American Indians in the state of Nebraska only account for 1.5%, it is very difficult to get an accurate estimate. So just to give you an idea, at the national level, the home ownership rate for American Indians is 53%. But because again, American Indians represent only 1.5%, that data or that statistic is not available for the state of Nebraska.
Great. All right, we are at the 11 o'clock hour. It looks like Dr. Logan may need to leave us. I'm going to ask you to help me do a little business on the air. Dr. Logan, if you need to go, that's fine. But I'm going to tee up next week's panel discussion, and then I'm going to ask a question of those who hang around. And the question is going to be, what historical policy do you think has had the greatest impact on the current state of inequity or race equity in Nebraska? That will be the question. But before I ask that to you, I'll just go ahead and let everyone know about next week's panel. It starts at 11, or starts at 10, I apologize. And it's going to be a historical look back at some of the policies that have got us here. But I was hoping maybe you all could help set the stage a little bit for that discussion. And I'll go ahead and start with Dr. Polk, who I hope you're still fired up. So.
Probably every single policy that's ever been developed has, no, seriously.
Right.
Because for one thing, we just recently in the last, 10 years, had a Native American person in the legislature. And we've had Senator Chambers in the past, of course, who tried to represent everybody, and he did an excellent job. But if you are not at the table, you're on the table, okay? And so that's why we still are suffering in 2020. So I can't say one because there's so many that got us where we are today.
Senator Conrad?
I think I got it. Sorry, my screen froze for a minute, so I had to jump back in. But thank you again to everyone for this robust discussion. I definitely wanted to give a shout out to OpenSky for their always good work, their helpful and careful and deliberate work. But also you've done some fantastic analysis about the state budget and how corrections is outpacing almost every other state obligation. And I think it's important for all of us to think about what that means from both a moral and a fiscal perspective. And those issues are going to continue to be really important in Nebraska as we have decisions in the near term about whether or not to build a massive new prison, for example, and what that means for this discussion and so many more. But I think that really, if you go back and you look either at the ACLU's report, A Blueprint for Smart Justice, that provides thoughtful policy solutions to address racial inequities and chart a smarter path forward for our criminal justice system. That's a good resource that I want to lift up. Or the State House to Prison Pipeline, which delineates how policy choices exacerbate racial disparities and mass incarceration in Nebraska. Those are both good resources. But in the criminal justice sphere, it really goes back to that tectonic shift that we saw in Nebraska, our sister states, and at the federal level, where for the last few decades, we've really doubled down on this poor public policy to be tough on crime and to enact a war on drugs. And that's what's really driving inequities and mass incarceration in Nebraska. There have been modest initial reforms to try and grapple with that, but the reforms have been anemic compared to how muscular and entrenched these policies are. So we've taken some first steps, but that doesn't absolve us of continuing the journey. So thank you so much for your time. And I think those are the drivers in the criminal justice space.
Thanks, Senator Conrad. Erin?
Yeah, so in terms of housing, the two, the historical policies are redlining and white flight. And I want to emphasize that both of these, we tend to treat them like they're choices, like they just kind of happen naturally. And I want to emphasize that both of these things are policies. They were driven by intentional policies at the government level, and sort of as a community, we're driven by those policies. So like Black people and people of color did not just decide not to go to the suburbs. They were intentionally kept out of them because of our racist housing policy. And those historical decisions have enormous consequences on our racial and ethnic inequities right now in our communities today. It's hard to overstate how important it is to include housing in any discussion of equity, because we are talking about people's homes. And the idea of home and what home means, it means the same to our neighbors as it does to you and me. And we need to start acting like that and operating from that foundational piece if we're gonna do anything. So on that fired up note, thanks to OpenSky, y'all are great, and really enjoyed this conversation.
I really appreciate you all joining us for it. And yes, you've teed up next week nicely. Again, so we're going to have a 4-person panel next week, kind of getting into some historical policies that have kind of contributed to our current situation. Because of the content, we are going to go ahead and block out an hour and a half because we think it will go that long. If the conversations go like we think they're going to go, based on our talking to the panelists, who we will publish soon, we think it's going to be a quick hour and a half. It's going to be really enthralling and enlightening session. So we really look forward to hosting it for next week. But thank you all for joining us. We got the 5 minutes back on the back end that we lost on the front end to the technical issues. So, and thanks to everyone for attending, and we'll go ahead and log off. And again, videos and slides will be coming soon. So thanks again, everyone.